ಇದು ಯೂರಿಕ್ ಆಸಿಡ್ ಅಂತ ಯೂರಿಕ್ ಆಸಿಡ್
Sir.
Number
3.8 uric acid.
fast.
Both the sides are तुम green.
If you do cardiac pulmonary resuscitation, no? So blood will start automatically from celebrated on every 29th of this month. Actually, why you are celebrating the World Heart Day? To keep awareness and preventive of cardiovascular diseases. Like each of the why you are celebrating this? Prevention is the most important. Prevention is better than cure, like that. So how do you have to prevent most important cardiovascular disease? In 50% of the cases you can prevent with risk factors. So many risk factors will be there. Some of the most important risk factors, some of the modified risk factors, another non-modifiable risk factors. Some of the modified risk factors have been included like this. The most important is diabetes is the most important risk factor. Hypertension is the most important risk factor. Dyslipidemia means cholesterol. That is also most important risk factors. And hypothyroidism. Hypothyroidism is also most important risk factor. These are all the modifiable risk factors. Some of the non-modifiable risk factors like age is a non-modifiable risk factor. That is the most important. You cannot escape from the age. So once the age advances, some physiological changes in the coronary arteries, any blood vessel like cerebral vessels, coronary vessels, and renal vessels. These are the age-related process. Atherosclerosis occurs. This is the age, and second one is the family history. Some of the family history like that. Some of the hereditary diseases like hereditary disease, patient will have sudden cardiac death in the family, but we don't know the cause of the death. Some of the like hereditary or genetic predisposition. Genetic predisposition in the sense sudden like hypertrophic cardiomyopathy, like electrophysiological changes in the long QT syndrome. These are the patients who have sudden cardiac death in the family. So this is about non-modifiable risk factors. We come to in detail, we discuss it. Modified risk factors. Modified risk includes what is heart disease. The most hard working muscle of our body pumps 4 to 5 liters of the blood every minute during the rest. This is how our heart works and supplies nutrients, oxygen, blood to all body parts including itself. And heart contains surrounding the coronary arteries. The main how to supply the coronary arteries. The heart muscle contains coronary arteries. Coronary artery divides into left main coronary arteries, right coronary arteries, left anterior descending artery, left circumflex artery. These surrounding the coronary arteries supply and pumps the heart to the all organs of the body. And then the most important is risk factors. What I told you, atherosclerosis. Why atherosclerosis comes? Because what we tell is cholesterol. In common terminology, we will tell cholesterol means body fat, means atherosclerosis. Cholesterol increases the cholesterol means why increases the cholesterol? The most important is lack of exercises, lack of controlling the diabetes, lack of hypertension control, lack of hypothyroidism control. These are some of the key factors. If you are not properly controlled, this leading on to atherosclerosis. Once the gradual atherosclerosis leading on to it, then there is a blockage comes. So when there is a blockage comes, patient will have a heart attack. Patient is a heart attack, come to emergency with chest pain, like emergency. Some of the patient will come to emergency chest pain to landing in our emergency cardiac department. Mild fat deposit all the old age states from 2 years of age, like foam cells, fatty streaks, intermediate lesion, atheroma, fibrous plaque, complicated lesion, rupture. What I told you, atherosclerosis starts with mild blockage, mild, moderate, severe. When there is initially start with the thrombus formation. Thrombus formation gradually leading on to the calcification. Calcification leading on to the complete rupture of the thrombus. Then the rupture of the thrombus leading a patient has come in the emergency department with acute heart attack. These are the common mechanisms like fatty streak, intermediate lesion, atheroma, fibrous plaques, complicated lesions, rupture. And not only the atherosclerosis common in the heart, this is also common in the cerebrovascular and renal disease and peripheral vascular disease. This also majority of atherosclerosis are common with cerebrovascular disease, cerebrovascular disease like some of the patients not attacked, they will come with a stroke, acute event. That is stroke means cerebrovascular event. They will come with acute ischemic stroke. Second one is hemorrhagic stroke. Third one is thrombosis stroke means a transient ischemic attack. These are all the flow matters, how the atherosclerosis, atheroma causing the stroke in the brain. And third one is the peripheral vascular disease. Peripheral vascular disease also same, like you have femoral arteries, popliteal arteries. These are the same mechanism causing the atherosclerosis, blockage of the blood vessels, major blood vessels. What are the symptoms of coronary artery disease? You heard some patients they will come with symptoms. What are the symptoms? How they will behave? Patients are behave. Suppose the youngsters, you have to calculate in 20 years or 30 years, 30 and 40 years. How the patients are coming? Suppose of the young man. Suppose young man coming. Suppose he is a long-standing smoker and alcohol. They will come immediately with chest pain landed in emergency department, causing acute heart attack. They will have a small thrombus formation. Suppose in 30-40 years, these are the gradual formation of atheroma, causing the blockage of the coronaries. They will have initial symptoms like they have chest pain. Some of the patients they come with initially center of the chest, they have burning sensation in the chest. Some patients have left arm pain. Some patients have throat pain. Some patients have neck pain. Some patients have back pain. These are the main important symptoms of the heart. Then some of the patients like long-standing diabetes, they doesn't have chest pain because of autonomic dysfunction. They doesn't have any chest pain. They have breathlessness. Breathlessness in the sense, while walking they have breathlessness, while climbing they have breathlessness. They can't able to walk. Then they will walk 1 meter or 2 meter, 3 meters. Then they will sit. This is the most important symptoms in a diabetic populations. And another patient they have come with syncopal attack. Some of the patient hypertension is like 180, systolic is 200. They have giddiness. Some patient have syncope, and some patient have syncope and loss of consciousness. If you do ECG, syncope, giddiness and loss of consciousness, they will have complete heart block. Patient is having inferior wall MI, means one of the segments of the right coronary artery blockage. They will have inferior wall MI. They will have complete heart block. The most symptom is giddiness and syncope. And how big is the problem? This is the most important cardiovascular disease. Is the #1 killer in the world. The second one is the stroke. Third one is the cancer. The cardiovascular disease is the most of the dreaded, important, the most of the important killer of the disease in the worldwide, globally. And second one is the stroke. And third one is the cancer. During the last 30 years, large declines in the developed countries, rising health awareness and government programs, alarming increase in developing countries, especially in India. See, after COVID to 2019, this COVID 2019, after 2019, 2020, we have some of the majorly the youngsters are coming with landed with the emergency department. But somewhere here we don't know what is the cause after the vaccination, probably after the COVID 2019. Some of the still some factors we cannot find out because majority these youngsters are coming to the hospital, coming with acute MI. This is the major what we are facing every day. Every day now, between 15 to 20 youngsters are admitting with acute heart attack. Because still we don't know vaccination. We cannot blame on vaccination, but still we are not able to understanding the factors. The most important factors in youngsters, they are coming with hypertension, and they are majority are smokers, and majority are alcoholic, and some of them are drug addicts. These are the what we are seeing in the college, and the majority are coming with so many drug addicts, and some weeds,